Is this the reason that you're burnt out? We know that nursing has incredibly high burnout rates, and burnout can lead to decreased job satisfaction, impairment in patient care, fatigue, mental health issues, and it can be caused by a whole host of things like increased workload, lack of support. And the thing that you never want to do is to be anxious about walking into that hospital or walking into your job. And oftentimes, nurses, day in, day out, they come to their job really looking to give support, to care for their patients. And oftentimes, their experience is very far removed from that. We come into nursing to really care, to support our patients, and to really be there during some of the most difficult times of their life. And the burnout rate for nurses is actually quite high. So within 6 years, most nurses will experience burnout and may even leave their job or the nursing career altogether. But one of the main causes, I believe, that isn't really talked about is an internal conflict. There's a conflict of values, which essentially is day in and day out, you're being asked to do something that may not be in alignment with your healing principles. For example, you might believe that being present, being connected with your patients, spending time with them is incredibly therapeutic and helpful. Except what you're doing from day to day is you barely spend time with your patient. You spend more time charting, and while your patient is, say, maybe emoting or crying, you have to now go and maybe answer a call bell. So it's that conflict of, I wish I could spend more time with my patient, and I'm not able to. Another instance could be that you may strongly believe that nutrition, supplementation is incredibly important for that patient's healing. And yet what you see in the hospital that's being given to them, or the diet and nutrition, is far removed from what you would do for yourself or for your loved ones. So there's a little bit of erosion there again. Another conflict in your healing principle and what you're practicing day to day. It's these small instances, but also large instances like this that create that conflict that we phrase as moral injury. And this, I believe, with the high expectation for nurses, the increased workload, all the charting that we have to do, this is what I believe is fundamental to the burnout with nurses. And with my demographic, with holistic nurses, because they have a much more holistic approach that really aims to connect, to be present, to look at the whole person. And they often ascribe to these healing principles. And most holistic nurses also have some kind of ritual to keep themselves healthy. And holistic nurses believe in this type of healing, the natural healing. Unfortunately, this doesn't function well in the conventional healthcare system. And with many of the nurses that I've mentored over the years, eventually they end up building their own practice, or they end up leaving the hospital or whatever system that they were in. And it's only a matter of time because they can't continue to function with this internal conflict. So then how do we prevent this moral injury? And really, it's a complex issue that won't be answered in a 5-minute video like this. But the first is getting really clear on your healing principles, on how you want to express yourself as a healer. And I offer workshops on how to be able to gain that clarity. And there's a free one on the website. It's called How to Launch Your Holistic Nursing Practice. I hope that this was helpful for you, and I hope that this helps you to understand what is fundamentally at the part of nursing burnout.